Hey everyone, most heart attacks don't come with chest pain. Nearly half are silent. Did you know that every year in the USA, around 250,000 people die from silent heart attacks where there's no pain or awareness at all? It's like a silent killer that can damage up to 40% of your heart, but you might not even notice. Is your body giving you signs right now? If you don't know, don't click away. Stick around because today's top 7 warning signs could help you save your own life. Listen up. These are subtle symptoms, but ignoring them can be fatal. Research from the American Heart Association shows that nearly 45% of heart attacks are silent, with no typical intense symptoms. That means you might have already had a heart attack without realizing it. This video could change your life, or the lives of your parents or partner. Check out these 7 subtle but deadly red flags from the silent killer that we often ignore every day. And at the end, we'll wrap up with a full action plan to save lives. Let's get started. Before we dive in, here's what you'll learn from watching this video today. 1. Which subtle signs you should never ignore. 2. Why these symptoms happen. 3. How to protect yourself and your loved ones. Knowledge is power, and in this case, it could be a lifesaver. So no more waiting, let's jump into the causes first, because if you don't know the reasons, no matter how hard you try to stay healthy, it won't make a difference. Cause 1. The silent nerve damagers. Diabetes and uncontrolled high blood pressure gradually damage our nerves and blood vessels. Especially with diabetes, a condition called diabetic neuropathy develops, where the nerves that sense pain lose their ability. So when blood flow stops to the heart and pain signals are generated, those signals don't reach the brain. As a result, instead of intense pain, the person just feels discomfort or mild unease. High blood pressure also thickens and stiffens the artery walls, silently increasing strain on the heart. Cause 2. High pain tolerance and mindset. Many people naturally have a high tolerance for pain, and our social and mental attitudes play a role too, like boys don't cry or can't handle a little pain. Especially older folks or men often dismiss pain as something minor. They think it might just be muscle strain, indigestion, or a normal part of aging. This mindset combined with high pain tolerance helps silent heart attacks go unnoticed. Cause 3. Atypical symptom dominance. Classic heart attack symptoms like chest pain or left arm pain are much less common in women, diabetic patients, and older adults. For them, atypical symptoms become dominant, like extreme fatigue, nausea, shortness of breath, back pain, or jaw pain. Since these symptoms don't seem directly related to the heart, patients and sometimes even doctors unknowingly look for other causes and don't focus on the heart. Cause 4. Gradual blockage and collateral circulation. In some cases, plaque builds up in the blood vessels slowly, over months or years, until they're completely blocked. During this long period, the body develops some alternative small blood vessels, collateral vessels, on its own, which maintain partial blood supply. So when the vessel finally gets fully blocked, instead of a severe crisis, the body might send a managing it signal, leading to a silent attack. Dr. Amitav Bandyopadhyay, senior interventional cardiologist at a premier hospital. The most terrifying heart attack isn't the one the patient feels, it's the one the patient doesn't even notice. We call it silent myocardial infarction. The problem is, since there's no intense pain, the patient doesn't seek treatment. As a result, the part of the heart muscle that dies turns into scar tissue later. This scar can never contract or expand. Before a year passes, this weakened heart heads toward failure, which is much more complicated to treat. So I tell everyone, especially those over 40 with diabetes or high blood pressure, to get at least an ECG and echocardiogram once a year. Follow this like a golden rule. You've learned all about the causes, so let's move on to the key warnings to watch out for. But first, a quick request. If you've liked this video even a little, please subscribe to the channel, give it a like, and share it with someone close to you. Don't forget. Warning 1. Listen to your language of discomfort. Your body is trying to tell you about any new, unusual, or unexplained discomfort, whether it's a heavy feeling in your chest, like hot water pouring, or just dizziness. Never brush these off with, "let's see what happens." When blood supply to the heart decreases, the first symptom isn't intense pain, it's discomfort. This is an emergency signal, so starting today, jot it down in a diary or phone notes. What kind of discomfort, when it happens, and how long it lasts. Try to spot patterns. Warning 2. Special awareness for women and diabetic patients. For women, instead of chest pain, symptoms might include pain in the upper abdomen, nausea, shortness of breath, unusual fatigue, or back pain. For diabetic patients, any physical discomfort like in the chest, stomach, or even just excessive sweating should be considered a possible heart signal. This is due to hormonal and neurological differences. Women's symptoms vary, and diabetes damages nerves, reducing pain sensation. So what should you do? Share these different symptoms with female family members and diabetic patients. Don't take their complaints lightly. Warning 3. Don't mistake fatigue for age or being busy. If suddenly everyday tasks like climbing stairs, carrying a light bag, or even showering cause unusual fatigue or shortness of breath that didn't before, that's a big warning sign. The reason is because the heart weakens, it struggles to pump oxygen-rich blood throughout the body. As a result, muscles tire quickly and shortness of breath occurs. What you should do is create a baseline for your capabilities. If you see a sudden and excessive decline in that baseline, consult a doctor. Warning 4. When shortness of breath speaks for your heart. If you have trouble breathing without any exercise or exertion, even while sitting or lying down, or if you have to sit up repeatedly to take deep breaths, it could be a sign of heart failure or post-silent heart attack condition. The reason is because when the heart weakens, blood and fluid build up in the lungs, called pulmonary edema. This blocks the lungs' air sacs from filling up, causing shortness of breath. So be alert if you develop habits like using extra pillows at night or suddenly waking up to sit and breathe. Warning 5. Don't avoid confusion with heartburn, gas, and digestion issues. Chest burning, sour burps in the throat chest, bloating, these symptoms match gastric issues, but these same symptoms can also be from a heart attack. The difference is heart-related chest burning usually worsens with physical activity or stress and eases with rest. Gastric pain is often tied to food and improves with antacids. The reason is that the esophagus and heart share nerve supply from the vagus nerve, so the brain gets confused distinguishing the signals. So what should you do? If your gas problem suddenly takes a new form or doesn't respond to usual meds, get an ECG quickly. Warning 6. Unusual pain in the upper body. Not just the left arm, right arm, both shoulders, upper back, neck, jaw, even teeth and ears can have pain or discomfort as a sign of a silent heart attack. This pain can come and go. The reason is that the nerves in these areas and the heart's nerves connect to the same spinal cord, so heart issues show up as referred pain in these spots. If you have pain that you can't explain why it started, like jaw pain but no dental issue, and it worsens with slight exertion, think about the heart. Warning 7. Cold sweats and dizziness. Sudden cold, clammy sweat coming from the body, especially when it has no relation to temperature or exertion, is a common heart attack symptom. It might come with a fuzzy head or a light dizziness. The reason is because when the heart's pumping ability decreases, blood pressure can drop suddenly. The body faces distress and goes into fight or flight mode, releasing adrenaline, which causes cold sweats. So what should you do? If such symptoms appear, sit or lie down. Don't eat or drink. If it doesn't subside in 5 to 10 minutes, seek emergency help. Serious pause. If any one or more of the 7 subtle signs mentioned above show up in you, something completely new, unusual, and persisting even after 15 to 20 minutes of rest, don't take any risks. Decide that you need medical help right now. Get out of the "it's late, I'll check in the morning" mindset. Even for silent attacks, the golden hour, meaning the first hour, is very important. This allows quick intervention to limit the damage to the heart muscle and prevent future complications. Pause. If the above symptoms are intense or if you're not sure, call an ambulance immediately. Don't try driving to the hospital yourself, because your condition could worsen on the road, which is dangerous for you and others. Ambulances have basic medical equipment and trained personnel. Tell them your suspicion about a heart attack. Positive shift. You can also create a practical plan. Prevention is the best treatment for silent attacks. Add colorful vegetables, fruits, whole grains, and nuts to your daily meals. Drastically reduce salt, sugar, processed foods, and red meat. Plus, incorporate at least 30 minutes of moderate aerobic exercise, brisk walking, cycling, or swimming 5 days a week. Add strength training 2 days. Also do 10 minutes of meditation or deep breathing daily. Ensure 7 to 8 hours of sleep. Learn stress management techniques. Finally, get a full physical exam once a year, including lipid profile, fasting blood sugar, and blood pressure checkup. Warm wrap-up. So friends, we have to face this silent killer not with fear, but with knowledge. Your body is an extraordinary machine that's always trying to communicate with you. We often don't understand or ignore that subtle language. If today's video teaches you that language of discomfort, then our effort is successful. Remember, before every major health disaster, the body gives small signals. It's our responsibility to take them seriously. Start today. Share this information with your whole family. You don't have to rush to the doctor's office tomorrow, but bring a positive change to your lifestyle. Walk more, eat nutritious food, manage stress, and get regular checkups. Your good health is your greatest asset. Protecting it is your responsibility too. A little awareness can prevent a big disease. Decide today, stay aware, stay healthy. If you found this video helpful, like it, subscribe to the channel, and hit the bell icon to turn on notifications, because we regularly share life-changing health info like this. In the comments below, write if you've observed such subtle signs in yourself or someone you know. Share your experience. Stay well, stay healthy. Thanks.